Therapy and rehabilitation. I am Dr. Hira, a therapist, and I've just passed from KM. We all know that all the patients have to undergo surgery, or even when they have fractures or something like that. Then the next part is rehabilitation, which will bring person back to the normal life. Like, it's not just getting person physically, but it's getting him emotionally, psychologically, vocationally, and in entire aspect, he has to get back to his normal life. If not like before, then at least how much ever it's possible, and to improve his quality of life. That's what is a major concern. Now, when we are seeing to the rehabilitation part, we see that sometimes frustration evolves. Frustration is nothing but frustration is nothing but the helplessness or when a patient feels that he's useless and he's not able to get back to his normal life. Now, normally when you see rehabilitation, there are 3 stages. First is early rehab, mid rehab, and back to normal life. Now, considering a sports person's rehab, like if you see Sachin Tendulkar or anyone, like once they have injured, they have to take 6 months break where they cannot play any sports, they cannot get back to their life. And it's, and they have to rehabilitate their soft tissues, they have to rehabilitate the condition which they are suffering. Not only rehabilitate, they have to strengthen them, they have to train them such that they have to bring back to the sport. Otherwise, it would be hampered vocationally. So, so frustration. So in early phase of frustration and depression results from the disruption to normal function. Then in the second phase, that is a middle phase, it is provoked because of negative appraisal of rehabilitation progress. That is like the patient is first very motivated. No, I will be rehabilitated. But sometimes he falls down. So that is a phase where he gets the negative appraisal. And the third one is the main instigator is impatient to return to the sport. Maybe doctor must have told them or the physio may have told them 6 weeks, but maybe after 4 weeks he wants to go back and play because of his peers and because of the vocational thing and because of the job requirements. So that would result in frustration. Now, frustration can also be seen in drug rehabilitation. Now, we see lot of cases of alcoholism, drug intake, like drug abuse, and patients like when you see even Lindsay Lohan, like she's under drug rehabilitation, but she is under frustration because she's helpless that she cannot leave that drug. So then we have rehabilitation penology, that is rehabilitation of criminal behavior, like the criminals who are undergoing the rehabilitation. Then you have neuropsychology, that is the stroke rehabilitation or Parkinson's rehabilitation. Then we have psychiatric rehabilitation. That is a major important one because schizophrenia, mental retardation, like rehabilitation of these patients are really long. Okay, so now we have types of rehabilitation. That is rehabilitation counseling, robotics rehabilitation, which is a very nice thing, but it's not developed in India. So it's very much developed in US, but still it's under a lot of research. And the third thing is tele-rehabilitation. That is via internet and telephone communication. Yes. So now, when we know that these are the problems which we are facing, so we have to cope with it. So I feel information therapy is very useful because whenever, like there was one patient who was a paraplegic. He used to see on net and find this is a patient, this is a patient. Definitely you get a lot of information on net, but all are not standardized. They may fall prey to a wrong information and they may get a wrong feedback. So what our motive is to provide them with an evidence-based proper information to them. That would be our motto, because rehabilitation is just not a physio's job or an occupational therapist's job or just any one person's job. It's a multi-speciality approach. So which all counselor, surgeons, psychologists, physiotherapists, everyone has to do a teamwork, which will result into a healthy rehabilitation. Now, rehabilitation is, you can say it adds life to years. It doesn't add years. We are not over here to tell, okay, 40 years ka hai, he will survive to 50 years. That is not our motive. You're surviving till 40 years, you have, better, your quality of life should be better to 40 years. So now coping up with that is information therapy. It is like prescription of right information to right person at a right time to make his health decision, a better health decision, because there are a lot of patients who do doctor shopping. Ye doctor ke paas gaye, next doctor, next doctor, next doctor. And finally they are confused what to do. That is like, so if they have an access, okay, like, and that too if a doctor says, or if a healthcare professional says, okay, see, these are the records, you can read it up by your own and you can make your own decision. Obviously we are there to guide you, but there are some patients who are like, nahi, hum log dekhenge, we will do the research and then we will think about it. Because rehabilitation in India is not still at that standard. The standard, it has to be there. Because patients are like, surgery is done, we are over and we will get back to work. They don't understand the need of their body, that once you are undergone a surgery, your body needs a treatment, it requires an adaptation. Like there is a blood loss, you have taken a rest, there is a nutrition loss, so you require proper diet, you require proper exercises, and then only you can get back to your work. Otherwise, the chances of relapse is more. So the right information, it should be evidence-based, which is most important, which is not followed, at least in a case of rehabilitation. Like evidence-based practice, I feel it's very important because already prior records are there, and maybe, you get an insight and you feel a little confident, okay, fine, this, it was way it is working, maybe in this person it can work the similar way. If not, a little deviation is there, but at least we get a base on which we can progress ahead, and maybe then we can make a deviations. Then we require right person, the patient and the caregiver, or caregivers who will share in decision on behavior change. Now the behavior is the most important thing. It's not a doctor's role, it's not any professional role, but it is a role of the family, the community and the society in which he is living, so that his behavior, his attitude towards his, not disability, but his impairments is not taken in a wrong way. And a right time, just in a time to make a better medical decision, because now he should not take so much time like doing research. He should be quick in the sense, he should not like waste time. Now if suppose there is a nerve injury and 3 months, 4 months he will take time, okay, I should go to this doctor, I should do this, I should do this. Time will go and nerve injury will not come back. Like the prognosis would not be that good. So obviously intra-family and social ambiguity, this is very important, because when one person in the family is a little off track, maybe because of his disease, disability, the entire family feels that thing, the change. So coping up with that is very important. So every family member is equally important in rehabilitation of that. It's not just a patient's point of view, but it's every family member. It's a combined approach. And obviously community resources and strength. When we see for the vocational rehab aspect, we have to get back to the community. And it is, if we have NGOs, like we have ADAPT at Bandra, where they take patients with disability, give them jobs and make them feel better. Now there is also something in US, there is an Olympics only for paraplegics, that's called Para-Olympics. And they have Olympics for disabled, handicapped patients. They play basketball, they do swimming, and it's really amazing. Like when you see that, and when you feel like, okay fine, you should go in that place and you should work at that place. And family counseling. Family counseling is really important because family is a major aspect. I feel family is a driving force. If your family is there with you, you do right or wrong, you have no friends, your family is there, you're sailed through. So there are a lot of technologies like electronic media record systems, then personal digital assistant. But what we need, like these are the examples of electronic infrastructure. But we need to, make them available to every patient. Like it's not that it should just be for the richer class or middle class. Even a lower socioeconomic status, if they want to get these information, it should be available to them also. So that's more important, which we can do it by organizing camps, which I think Chevy is also doing, camps and all. It's really nice. Then there was a camp organizing it in like in Dharavi area or like in a slum area. Then there's also called as information triggers, which should be allowed in the system, because there would be certain information and it should be like a blog sort of thing. Like a blog is available. If a patient has some questions, he can put it up, and the answer should be by some healthcare professional, and it should not be by any random person. And we can, and it should be useful, and we should keep track of information. Like once we have opened a blog and all those things, it's like our duty doesn't end over there. Maybe every week or maybe every month we can keep track of such information. Because what normally happens, like we are very enthusiastic at start. Okay, fine, like we will do this, we will do this. But we forget that we require triggers. Even when we have exams or something like that, we require a trigger. A low marks can be a trigger for us. Okay, we need to study better. Or something, a setback in your life is a trigger. Okay, we need to achieve more higher points. So that's more important. And yeah. Thank you. And this is more of, yeah. This is more of information therapy, which I think it's practiced over here. So that would be on the evidence-based practice, because we have the evidences of those patients. Role models. Being a tablet.
What I give an example. The government provides, let's say, railway pass for the citizens. You know anything about it? What should be Europe?
No, but they have a special boogie for them also.
Yeah, you don't know anything about it.
Yeah.
My point is, someone who's been for 5 years, you know the phone number, the address, the spoke in the car, what the pass does, क्या problem हो सकता है. The amount of practical useful information you provide to be on all the way.
About maybe he can also tell about his own history, like what levels, like even he would have felt the levels of depression, how to cope it up with it.
But what else? The other biggest one. A is not charged.
Yeah.
Family. Care resources. You are busy. You have 15 days. We have. You're going to give 10 minutes. Then you have to go on to the next. Then when you hook up this person, you become the part of the money.
Yes.
He's available on his mobile, he's available. Then it's not just 10 minutes or 15 minutes. Or he's taking the what? Patient business for him. So rather than the patient is liable for the same note, have a he's coming from what? Have it.
We can do in team we don't have. But when we are in OPDs and we have some regular patients, like suppose in a neuro OPD we have a patient who comes for like past 5 years. She's a Parkinson's patient. So she is the one who tells, when she sees another Parkinson's patient, she tells that this. How did I rehabilitate? How did exercise help me?
You have a real life example. There are patients. I know all these you have a mobile number, you have a phone number, you can she's not for one day. Suppose tomorrow you see another patient with Parkinson's, suppose you could benefit as a result, then you have your that's there's so many people who are resources, someone has a spare wheelchair, for example, and that's all. You do a lot of stuff. Then each other and I think you will end up what do you know? What you know is what you learn from your book. Yeah. And again, all the time say the results theory. There's lots of clever stuff happening here. You know, for example, there's something called wheelchair benefit.
Wheelchair benefit?
There's stuff happening within corporate. Okay. I'm not blaming you.
Yes, yes.
Why would you know about it? Created some of these resources. Everyone has some kind of directive. what can you do? No, anyone can say, yes, I know this is available for that.